The number one question of the day, everyone keeps asking me, with new administration, will we have Medicaid expansion? It ain't gonna happen. It ain't gonna happen. And I'll be honest with you, I do feel bad for hundreds of thousands of people who are without adequate health care, who are without adequate help, who are without the things that they basically need to function in a society. So a couple of things I'm gonna touch on today that are super important that I hope you've never thought about, or if you haven't thought about, I'm gonna bring and introduce them to you. There's 3 reasons why Medicaid will never expand. And if anything, it's going to be cut before it's expanded. And follow me here, because the third one is pretty insane. But number one, there's just not enough doctors. So when someone lives in an area, particularly an area like Georgia that is so spread out, you're gonna have hundreds of thousands of people who live over an hour to get to a doctor. And so when you're looking at the statistics and what does that look like on paper, if you were to take a map of the state and you have someone, you might say, well, you think most of people live in Atlanta, that's all you hear about. The truth is, that's a very small area, Atlanta is. That's why it's so crowded and compact all the time. But the reality is, you have people all over the state. You have people in South Georgia, North Georgia, East Georgia, and I don't just mean like Lithonia, I mean very far East Georgia. We have people far up north. We have people all over the place who are struggling to get access to adequate health care simply because they have Medicaid. And it's not that these people should be punished for having Medicaid, but in reality, it feels like to me we're punishing them. The biggest reason is because we don't have enough doctors, right? And so I saw a bill looking to be passed last week or so, actually, and we'll post that really, and I'll post a video talking about it that talks about how we can get more doctors in Georgia. You have a lot of people who are in the hospital systems who believe that we have a shortage of doctors simply because the insurance is too high. And one of the reasons the insurance is so high in Georgia is because you have a lot of malpractice cases where you have people having to pay out millions of dollars for what they find to be unnecessary expenses. To me, I think those things are fair and justified. I think someone who, first off, let's say you're suing a doctor or a system, you're really suing their insurance, not the person themselves. But a lot of doctors don't want to come here because the insurance is so high. I'll give you an example. Just talking about hospice insurance, my insurance in Georgia is, I think, $13,000, where in Chicago it's like 5 or 6, just to give you an idea of what the difference is and why someone may choose to work in other states. So for one, there's just not enough doctors. But there not being enough doctors, even if there were enough doctors, I still don't think they would expand Medicaid. Because ideally, what happens in red states, like I said before, I do think more states will become red states, even though I don't think people realize what they're doing when they're voting. I do think that there is a huge population of people who are dependent upon a small percentage of doctors. And so a lot of those doctors have to go to places where the insurance is going to give them the biggest payout. Because in America, think about how much it costs to become a doctor. You got to go to school. You got to go to high school. You got to go to college. You got to go to medical school. And some people go to grad school before they go to medical school, depending on what their grades were in college. Then you got to go to residency. Then you got to go to whatever specialty you want to do, right? So before you know it, you're probably $400,000, $500,000 to $1 million in debt just in becoming a doctor. So for you to actually service the Medicaid population that pays you, I don't know, 50 cents to your bill, maybe 30 cents to your bill. I think Medicare is about 60 cents to your bill. It's just not a sustainable outcome for the doctor. And while that is sad, it is the way that America is set up. How do we fix this? I don't know. I do think we need to get towards universal health care, but that's a different story for a different day. The second thing that I think is important, particularly with Georgia and a lot of other rural states, people are really spread out. So just for us, we take care of people who are 50 miles from our office in any direction. So if you're in Fayetteville, we can go all the way up to pretty much Alpharetta. We have patients, and as far south as, it's not as far as Macon, but it's probably about 30 minutes north of Macon. So it's a pretty big way that we can go. But imagine if you lived in Alpharetta and your closest doctor was in Macon. That's a 2.5, 3 hour drive for you. And when I say closest doctor, doesn't mean there's no other doctors in the area, but there's no other doctor that take Medicaid near. So how are you going to get seen? That's a huge problem that they're going to have in Georgia. And I don't see that getting any better because, like we said before, I don't see doctors switching to a program that's going to pay them 30 cents on a dollar when Medicare pays them 60 cents on a dollar and private insurance pays them 70 to 80 cents on the dollar. When I say on the dollar, I mean, if they charge $1 million, they're going to get 70 to 80 cents, which would be $800K on the $1 million for whatever service that they charge for. So that's another another way to think of it when we talk about this realistically and what it's going to look like. The last one, and this one's going to hurt, but I just, for whatever reason, as someone who's been in healthcare now for 10 years, I don't think that this country was set up for everyone to have access to everything. I just don't. I don't think this country was set up for people to have quality healthcare, and I don't think this country was set up for everyone to live a long time either. And I think when you look at that and you take into consideration where we are as a country, and we're still fighting for health equity 100 years after we first brought this up, if there's no reason to change it, or what's the reason that no one wants to change it? And so it's dependent upon people like myself and other people in this industry to do our best to go into your areas and do what we can to provide services for you and not focus so much on that. Now, this is the hidden gem I'm going to give you. Everyone's going to be upset about it. If you are sick, you can go to a hospital even if you have no insurance. Now, you want to think about this and you're saying, Henry, I don't believe you. I guarantee you, if you are sick, you can go to any hospital and get seen. They will evaluate you. I'm not telling you they will cure you, but they will at least evaluate you. I'm also not telling you that your wait won't be 12 hours, because it might. But the way that the law is written, we have to take care of anyone that comes in, whether they have insurance or not. So that's your gem for today. I hope that helps you. If there's anything else, you know where to find me. I'm Healthcare Henry.
Life is precious.